welcome our witnesses and compliment Koch on his work over the years. As Michelle said, we had engagement with Tom Daly many times, and always very positive engagement. I don't think I'd engage as positively with him now when he's trying to take the Ulster final out of Clonus to bring it to a revamped Casement Park. We'd have a slight difference of opinion in regard to those issues, so we would. But just to compliment Tom and all of you who have pushed out the Koch programme so successfully. And I have to say, Koch was very fortunate in its place of birth in Ballyconnell, so it had a very good start to life in the first place. But anyway, I just noticed that you've quite a disparate number of groups to work with in Northern Ireland. We often think that our health service isn't consolidated enough, but when I see the number of different partners and providers you have to engage with in Northern Ireland, I'm sure it's not that easy. Could I just say, the Minister for Public Expenditure and Reform, Michael McGrath, has indicated to us that he expects to sign off on the Peace Plus programme in the not too distant future. And you know, within our own parliamentary party, as Senator Blaney could attest to, we've been urging him to move it along as quickly as possible, and I don't think there are any obstacles foreseen at this present stage to sign off on it. And you know, whatever we can do to support the programmes that you will put in for consideration, we'll be very glad, because all of us would have experience of the good use you have put relatively small money to in the past. It influences all of our opinions. Could I just say, Rose touched on some skill shortages on the medical side. We also know of the shortages of other clinicians and therapists and nursing shortage as well. Do you have any particular project where you would be training people specifically for the border counties, say on the basis of collaborating with the Institute of Technology and the general hospitals? I know my own local hospital in Cavan General, we would have student nurses who are doing their nursing degree in Dundalk Institute of Technology. I assume it's the same in Sligo as well. But could there be a specific project to try to train more people, and hopefully those people would take up jobs in the area where they are trained? Because I think it's not easy to attract young clinicians or whatever particular discipline to more remote areas. That's the reality. And go back to the GPs as well. I know that it's generally accepted that the age profile of our GPs in rural Ireland is high, unfortunately, and it won't be easy to get replacements. And I know that the HSE, a number of instances I've dealt with in my own constituency, have struggled to try to get people even to apply for some vacancies at times. Now, we have two different health systems, north and south. Is there any way that consideration should be given to some cross-border GP practices? Like, you take a remote part of the area that I represent, go into your own area, Damien, in North Leitrim, back Cavan along Fermanagh. There would be small GP practices on both sides of the border. When the practitioner retires, it's extremely difficult to get a new incumbent. I don't know, but it might be worth giving some thought to it, to practices being merged or being amalgamated to some extent. And I appreciate the structural difficulties there would be with two different systems, but we have to think outside the box in regard to trying and ensure that we have reasonable access for people to GP care in rural areas. I think it's extremely important. Could I just say one other thing? And we are living in an era now, and with the particular emphasis by An Taoiseach and the government on the shared island concept, we think we have to see more working on a cross-border basis. We have to see more collaboration. Over the years, say in the past, when the hospital in Omagh used to provide ENT services to Cavan Monaghan, now that service is provided by Coleraine, a limited amount. But I think I don't know if it's in your remit, we have to have more provision of acute services on the basis of collaboration. When there was a big challenge in regard to replacing the Erin Hospital in Enniskillen and replacing Omagh, I remember at the time the thinking was that with the very substantial Southwest Hospital, that there would be collaboration with Sligo, Cavan General and the new Southwest Hospital. To my knowledge, that has never been achieved what we want. And we have to have a focus on delivering services on a cross-border basis, particular specialties, etc. And I think whatever blockages there are, that we have to try to move those out. Because if I have a constituent in Cavan or Monaghan, they want to get the service as quickly as possible. Similarly, I'm sure, with our neighbours north of the border as well. So if you could maybe give us some update on, is there any progress being made in that respect? Or what maybe, and I know you are delivering services, but I'm sure you have an input into policy. And I appreciate that up the line, the department at government level as well. But maybe give us an insight in, is there any thinking going in trying to intensify cooperation and the delivery of services at general hospitals on either side of the border to service the needs of the people on a cross-border basis in some particular specialities. So again, just very much welcome the work that you do, and we will, as a public representative who has been familiar with that agreement from its inception, I would be very glad to support your work, and I sincerely hope that the programme you put forward to the special European Union's programme body, that it meets with approval. Thank you, Oireachtas.